We've published a one-year follow-up of a cohort of patients whose cancer was first diagnosed after they presented to the emergency department in all of the A&E departments across our system. So it was nearly 1,000 patients. They were diagnosed in the first 9 months of 2013. And since that time, we've been doing some work to follow up what's happened to them. We're very concerned about late diagnosis of cancer, particularly in North East London. We therefore wanted to understand why patients were going to A&E rather than to their doctor when they had symptoms they were concerned about. And we also wanted to understand what happened to those patients. We therefore worked with all 11 A&E departments across our system to get the frontline staff to tell us when a cancer patient first presented through the emergency department. We then worked with those teams to look at the patient's story both inside the hospital but also to write to their GP and get the route to diagnosis. And what we found was we had 963 patients diagnosed across a 9-month period. About a third of them had lung cancer. The next commonest diagnosis was colorectal cancer, and after that, cancer affecting the liver, pancreas and biliary tree. The data we're presenting now is to see what's happened to those patients at least 1 year from diagnosis. And the results are really quite shocking, though unfortunately not unexpected. So overall, a quarter of the patients are dead within 2 months of first presenting to A&E. If you're aged over 65, only a quarter of the patients were still alive 1 year after first diagnosis. For the younger patients, the group under 65, just over half of them were alive 1 year from diagnosis. This is a terrible problem and we really need to take action. We have previously presented at last year's NCRI conference what the routes to diagnosis that these patients had taken. So the vast majority of them were registered with the GP, and many of them had been to see their GP about symptoms related to their cancer. In many cases, the GP had actually tried to do the right thing. So they had either sent the patient on an urgent referral to the hospital, or they had requested some tests. But because the system's too slow even for an urgent referral, some of these patients had deteriorated whilst waiting for that appointment or test and had therefore taken themselves to the A&E department. So we've clearly identified that we need to bring primary care and hospitals closer together to improve access to diagnostics and clinical advice for GPs when they see a patient they're worried about. Because many of these patients could have been managed and investigated in an outpatient setting if testing had been initiated earlier. However, what we found is that many of the patients coming to A&E had quite advanced disease at diagnosis, to the extent that the treating oncology team felt they were only suitable for palliative treatment and they were beyond the stage at which curative treatment could be offered. This was the case in 80% of the patients in whom we knew about the treatment intent. So this is very late diagnosis, and we're only going to tackle that by raising public awareness of the signs and symptoms of cancer, encouraging patients to go and seek medical attention earlier, and I think most crucially, encouraging GPs to do more diagnostic testing earlier and make it a more efficient system for the local health economy. In the British NHS, an urgent referral is counted as one where the patient must be seen within 2 weeks from first GP referral. However, that doesn't mean they get their test within 2 weeks. And in fact, sometimes perversely, going through a clinic can actually slow down the process. So what we need to see is when a GP recognises worrying symptoms, they're able to access a test and get the result and a clinical opinion within a much shorter space of time. And indeed, our new national cancer strategy nationally for England recommends that we switch towards a maximum of 4 weeks to get every patient with worrying symptoms tested, seen, and with a definitive diagnosis about what's wrong with them.